on a Friday morning as well. So definitely Crystal keeps us on our toes. Today we are going over our very special Sidney Health app. And so basically this is what you can download on your smartphone or tablet. We always talk about it. You'll hear me talk about this if you've attended other webinar series or during open enrollment. So we do have a special guest speaker. His name is Jonathan Schneider. My name is Tammy Rowe, and I am one of your account managers assigned. I'm sure many of you have seen my face over the years. And then Raymond, I don't know if you're able to introduce yourself.
Yes, hey, good morning, everyone. My name is Raymond. I'm also one of the account managers for Lacers. So Tammy and I work closely together to service our Lacers retiree members.
Thank you. And so Jonathan Schneider, I'm going to pass the baton to you, and you're welcome to share your screen. And if you would like to introduce yourself and say a few words, that'd be great.
Sure. As Tammy said, my name is Jonathan Schneider. I'm on the Sidney Health team. And I'm going to go ahead and I think the first thing we would do is just jump right into the demo and kind of walk through that. Let me just go ahead and see if I can get my screen share going here. Give me one moment.
Yes, I just made you co-host.
Okay, thank you. Okay, I think you should be seeing my screen. If you could just verify that you're seeing the Sidney Health app.
Yeah.
Excellent. All right, great. So what we thought we'd do today is just kind of give a overview and a kind of walkthrough of some of the different features that we have in the mobile app. The first thing I'd like to say is that when you download the Sidney Health app, you use the same username and password that you use to log into your web experience. So if you've already registered and are accessing the secure experience at anthem.com, you can download the Sidney Health app on your phone or tablet, and then you can just use those existing the same username and password that you use to log into the web. It's all the same username and password. You register once, use the same username and password across both web and mobile. So you don't have to go through any type of re-registration process. Similarly, if you download the app and register first there, you can use the same username and password to log into anthem.com. So again, just one login for both experiences. And you'll see that as we kind of walk through, if you're familiar with the web experience, a lot of it's going to be very similar to what you've experienced there, just formatted for a little bit different size screen. So same features and functions that you're going to have on the web, you're going to have across the mobile device as well. So once you log in, you're presented with a login screen, or excuse me, a landing page after you go through the login screen. And that's going to be some of your kind of quick links. Similar on the web, we have the same type of information and modules that you can click into. We have some quick links across the top to access certain features and across the bottom as well. And then on the landing page itself, we start out by showing you any action items that you may be of interest to you, maybe a reminder for preventative care, or a notification about a claim that's been received and things like that. You'll have the ability to kind of see your plan usage and your latest claims there as well on that landing page. For the plans that have a pharmacy benefit, you can access some quick links right there on the landing page as well. And also to see any programs or clinical programs that are part of your plan. You can get a quick highlight and then go into view all of those from there as well. So what I'm going to do first is kind of start at the top here. One of the nice things about having the app on your phone is that you always have your ID card with you. So if you log in, you can pull up a copy of your ID card, and it's the exact copy of what you would carry in your wallet. You do have the ability to download or share that as well if you need to, either with a doctor's office, or you can initiate that right within the app. You can do this on the web as well. You have the ability to download it for offline use as well. So you're not dependent on being online, or if, sometimes when I go to my doctor's office, the building itself, the cell signal is not very, very good. So it's nice for me to have it downloaded for offline use, and I can pull up my card right in the doctor's office and not have to worry about cell signal issues in the clinic. So that's right across the top. You always have access to that, right there at the top of the screen. We also have a quick link to the Secure Message Center. And that is where you can interact with customer service. It's a secure messaging within the app or the website. And so if you have a question about benefits or a claim that you received, things like that, you can create a message, send it over. It functions very much like email. So you're gonna be sending the message, and then a day later get a response, or sometimes it can be a few hours. But it's more like an email exchange from there. We do have the ability to do live chat as well. So you'll see this little how can I help you with the little Sidney icon there. You can always click that within the app, and it's also on web. So you'll see that little Sidney icon in the corner when you log into the web portal as well. And you can go ahead and chat. If you're just looking for information, we may be able to direct you, to your ID card or benefits page. And if you want to talk to a customer service representative, member services representative, you can initiate that as well and have a chat right within that live chat experience. Across the bottom, here we have a quick link to your claims information, so you can pull that up, and it's going to be sorted by the type of claim or type of plan, whether it's medical, dental, pharmacy, and you can click into those to drive deeper into the claim information. So here, if we go into, whoops, it's not working for me. Let me try that again. Okay, sorry. It's not loading. But if you click into the type of claim, you can see a listing of all of your claims. And then you can also click in to see the claim details. So you'll see the breakdown of what was charged, what was paid, if there's any responsibility to you for that claim. And then if there's an explanation of benefits, which is the document that you're used to getting either in the mail or by email, that kind of breaks down that that claim in detail, you can pull up a copy of that right within the claim information there as well. Or again, you can do the same thing on the web as well. If you're looking for a provider, you can go into the care quick link on the web. You'll see it in the care menu, and you can click to find care. So you can go in and do a provider search. If your plan has any virtual care options, you can link to those as well. If you have like Live Health Online, and some of the other plans, I think for the early retirees have the virtual primary care, chat with a doctor. You can initiate that there as well. If you want to do a traditional provider search, you can go into find cost and care, care and cost, and pull up a provider search. You would type in what type of specialty you're looking for, what type of doctor, or if you know the doctor's name, you can put that in there as well. And then you can pull up the doctor's information, right from there to get their address, phone number, etc. The other important section is the pharmacy section. So this section has all of your pharmacy tools and pharmacy information. When you go into the pharmacy section, you have the ability to check order status, review your prescriptions, whether you need to renew or refill those. You're going to see your prescriptions and the information about how many refills you have left and all those types of things listed right there as well. And then we have a couple of tools for finding a pharmacy. We have a price of medication tool as well, and a drug interaction checker. So all of those tools are available within the pharmacy section. Again, same on the web or the mobile app. So all of that's very useful in this one section to manage your prescriptions. On the mobile app, you're going to see this little more button at the bottom, on the bottom right. And this really gets into all of the features that you have available to you. So, we put these quick links at the bottom and the quick links at the top for the kind of the things that people use the most. But there are many more features that you can access within the app. So we go into the more menu, that's where you're going to see a listing of like your plan information. You can go in and view your benefits there. Information about your pharmacy, which we were just there, your ID cards. Health Pass, that you have the ability to take a picture of your immunization card. And we launched this during the pandemic for a way to easily have your COVID-19 vaccination information readily available. So you can use that on within the mobile app to take a picture of your vaccination card and have that with you at all times. You have your claims information and history. The links to do a provider search and find care information. Those are there as well. The community resources section, this allows you to search a database of local community resources, be it financial assistance, food resources, housing, counseling, all of those types of services that might be available to you. We have linked in a database under community resources. So it's very helpful to find resources and information about services that are in your area, or transportation services, all those types of things can be accessed within this community resources database. You have the ability to pull up a listing of your care team as well. I don't have it on this demo, but it's basically a curated list of your doctors. So instead of having to go through the provider directory and do a formal, search and pulling up your doctor's information that way in the traditional Find a Doctor tool, when we have claims information, or you can manually add and remove doctors from your list, it's going to be specific to you, and a listing of a page where it lists your doctor. So it could be your primary care doctor, any specialists that you see, those are going to be listed there, and you can have their information quickly accessible right through the care team page. So again, that's specific to you. Those are your doctors, and you can manage that list as you see fit if you're adding or removing members for that. But it's a great way to just quickly dive in and grab a doctor's phone number or something if you don't have it handy, and you can see those doctors right in that list. The My Health dashboard, this is really your health and wellness hub. So if we go into there, when you first enter it, either on web or mobile, you're going to be presented with an option to kind of express your your self-reported interests. So what type of health topics are you interested in? What type of wellness information are you interested in? And then we can use that information to help kind of curate health information that's specific to you. So we're going to show you, some wellness articles, or maybe recommend some action plans that you can take based upon your interests. So when you go in and you report those interests, you go through that process. Then again, you have the ability to see news and information that's pertinent to you. We also have action plans that you can initiate as well. So let's say you want to be more active. You can initiate that action plan. We can give you steps and information to kind of guide you along the way. And so the first, being more active, the first, information we might show you is an article about, exercising and things like that. And then we maybe give you a step goal, that you can track and kind of work your way through those action plans. So we have, I believe, 6 total action plans right now. We have being more active, achieving a healthy weight, eating healthier, sleeping better, things like that you can go through, initiate those action plans, and we will kind of give you step by step how to get through those and reach your goals in those health and wellness areas. The other thing you'll see in that My Health Dashboard section is we do have a nutrition tracker. So if you go into that, you have the ability to kind of track your food and information, and it's really really nice because you can not only just scan like the label on foods, but you can also take a picture of your food. And so you'll walk through this the first time and kind of give your information and kind of what your goals are. And then you can actually go through and track for the day your nutrition. Again, you can scan a label. You can search for it. You can type in the a banana if you want from the keyboard, or you could actually just take a picture of a banana and it will pop up and allow you to track it that way. So it's really nice and easy to use, for tracking your nutrition. So let's see. Let me jump back out to the main Mind Health Dashboard page. Along with the activity plan or action plans and the nutrition tracking, you have the ability to link a device to track your activity. So if you download the Sidney Health mobile app, if you're doing it on a phone, you're doing it either on an Apple iPhone or on an Android phone, you can then also sync up the Apple Health, or if you have a Garmin or a Fitbit, you can link that to Sidney Health and be able to track your activity there as well. And so what's nice is if you're doing those action plans and you have maybe a Fitbit, you can log into your Fitbit account, link it here, or go in here and go through the process to link your Fitbit account. It can share that information with the Sidney Health app about how many steps you're taking and all of those types of things. And then when you're going through the action plans, you can see what you've completed, that day, and it can automatically track that information for you as you work through those action plans. I mentioned before the clinical programs that are part of your plan. This is the programs page is where you're going to find that information. So anything that is particular to your plan that might be available is going to be listed here. And if you click into any of those tiles that have the clinical program, it's going to show you the details of what that program is, how to get information about it, how to get started with it. So definitely I do recommend either web or mobile, logging in and checking out the programs that are part of your plan. So again, these are clinical programs or health and wellness programs that might be available to you. Dig in and see what's there beyond your traditional benefits that you might be able to access. The last part of the health dashboard is the My Health News. Again, if you've gone through and self-reported what your interests are, you'll be able to see that curated here for you. My Health Records, this section, I don't think I have it on this demo, but this you are able to go in and access your health records. So it could be lab results, things that any health information that your doctor has provided that we have access to. We can report that out here to you. So you have it all in one central location. You also have the ability to link up with your doctor's electronic medical records system as well, if you choose. So by default, we're only going to display the information that we have available as Anthem, to you. But if you want to go a step further and bring in other information from, some of those other systems, like if you have a MyChart account or things like that, you can link that up and pull all of that information into one view as well. So it's a great way to kind of centralize your health records and lab results and all those kinds of things just into one place. I mentioned before the live chat and the message center. We also have a contact us page with any pertinent information and phone numbers that you can go into and access quickly and see those phone numbers for member services. You also have those, remember that those are always displayed on your ID card as well. So you could go into your ID card and pull up the back of your ID card and see those phone numbers there as well. So those are all of the sections that I wanted to cover today. Tammy, did you have any additional comments?
On that more, there's the submit the claim, because this will be a big one.
Okay.
Because for the Medicare Advantage plan, as you know, you have in and out of network providers at no additional cost. So there's no cost share difference. So if you do end up seeing one and they say, I don't want to build a plan, I'm not contracted, then this is where you can submit that bill.
Yes. So both web and mobile, you have the ability to submit a claim. As Tammy said, you have the in and out of network, but if you're in network, the provider should be submitting the claim for you. So really, this only comes into the scenario where you're out of network. The doctor, may not be submitting the claim for you, and you need to take that step to get that claim submitted. So what you can do within the submit a claim function, it just walks you through, going through and putting in the claim information. And then you can actually take a picture of your claim right from your phone and upload that and initiate the claim submission. So it's a very easy process to do, especially I think easier on the mobile device, because you got camera built right in, and you just snap a picture of your paper claim and upload it. And then you'll be able to see and track, any claims that you've submitted within the claim submission section. And then once it's actually in our system, then it will show up in your claims, regular claims view as well. So, but it's a great feature to be able to just quickly submit that claim from your phone. Again, it's really only something you're going to deal with if you're out of network. So remember, most of the cases you're in network, your provider is doctor is going to be submitting it on your behalf. So great.
Awesome. Great. Thank you so much. Do you guys have any questions for Jonathan? Because he really went thorough for that, for the app. And so just want to see, I do want to point out, like when he mentioned the Find Care, I say this every time, it's really helpful for when you're traveling because you have GPS capabilities on your phone. So
Yes.
if you travel, it'll take where you are at into consideration. So if you need urgent care, you just can type it in, very quick and easy for you to go find. And then that care team, especially if you don't see your specialist like that often, there's times where I'm like, I can't remember who I saw. And so I put them in my care team so that I have it right at my fingertips and I don't have to sit there and think and go through my EOBs to find it.
Yeah.
And that activity tracking, you all have a Fitbit that is available to you through Anthem for $0. So if you took advantage of that, or if you have your own, if you have a smartwatch or the Apple, like Jonathan mentioned, feel free to connect it with this app. And then I love the tracking of the food, and I didn't even realize you can take a picture. So I even learned something. That's great.
We got Joyce. Yeah, Joyce's hand is raised. Go ahead, Joyce.
Joyce, you're
Okay.
on. Oh, there you
Okay,
go.
I'm sorry. I was trying to unmute. You know, there was a question. How did you connect the that medical information with your doctor and with your labs and things like that?
Yeah, when you go to let me see if I can pull up this. Okay, so it's going to be in the My Health Records section. I don't have those screens on this this view. Let me see if I can pull up a different one. But while I'm doing that, by default, we're going to be able to show you in that view any information, lab information, test results, things like that, that we have information to on. And then there's an option within there that you can go ahead and do a connection to a health system. A lot of them use these larger electronic medical record systems like Epic or Cerner. And those, like Epic, it uses the MyChart app and system to access that information. And I'm just trying to pull up. I don't know if I have that handy, but let me see if I can.
I guess they say they give you a password, but I guess the last time I went to my doctor, I went to and I got I think some labs done, and they said I can access, but then they said you have to get the password from your doctor. Does that sound right?
It could be. It could be. It's a different system from ours. So, you would be, if you link that, you would be going in, entering those credentials, and then allowing access to link over. But it would probably be dependent upon the system that the doctor's office has.
Okay.
That you would need to, yeah.
So
Joyce, that could very well be.
Yeah, I was going to say, I know a lot of times, so there's two separate ones. There's when you go to the doctor, they have their own portal that you can message them sometimes, and depending on the medical group or the doctor's office and how tech savvy they are. But with this one, I went and I get my annual physical every year. So I get that lipid panel done so I can see what my cholesterol is and my A1C. And those automatically upload to this. So I don't have to I'm not even connected to my doctor's system. So when I went into my health records, it shows me. So it's you don't have to do anything as long as you're logged into the Sidney Health app and you go to that My Health Records, it should show there.
Yeah.
Okay.
Yeah.
As long as the claim came through Anthem.
Yeah.
Okay.
Yeah. It would really be linking in any additional information that you would want to view there. So, yep. Yeah,
Okay.
and we may have everything that you need already to view there. But again, if you want to link in additional, you have that option.
Okay, I'll look at it then. Thank you.
Okay, you're welcome.
Yeah, and that's really helpful, like especially if you're seeing a different doctor. Sometimes, your medical records aren't in the same system. So when I
Yes.
went and saw a new doctor, I was like, what were my labs last year? So she knew what to order for this year. And so I was able to pull it up on my health record and say, hey, my cholesterol's, this. And so
Yep.
she was, my BP is this. And so it's awesome. I love that feature.
Okay,
And then-
so it should be in my chart if I'm doing it. Okay.
Yep.
I'll look
And
and
then
see.
you can share that too, especially if you see a provide, like, especially with the PPO plan. I know my doctors weren't necessarily talking, and my, primary care physician's like, oh, I didn't get those records. So I'm like, I have it. I can download it straight from there so that I could give it to her, or at least let her know who the doctor was too, to get them. But it's kind of nice just as an ability to be able to do that. If you have a caregiver, if you're concerned about something, and let's say your son is a doctor and you want to share these medical records with, it's up to you, and it's private. So.
Okay. Thank you.
Do we
Any
have
other
any other
questions?
questions?
That really sounds good, Tammy, but with my doctor, for every doctor I go to outside of my primary doctor, I make sure they send him a copy of the report. And
Yeah.
if I go to him, my primary doctor, and he say, oh, well, we don't, I says, didn't they send you a copy of the report? That lets me know that my doctor did not review the records before he met with me.
Yeah,
You got it.
that's a good plan.
And that pharmacy is really important too, just to make sure if you want to sign up for that home delivery or auto renewal is really important, because I know I kind of get in a rut and I'm like, oh, I'll order it later. But with auto renew, if you have a prior auth, it needs to be, if the prior auth is set to expire, by selecting auto renew, we'll take care of it on the back end automatically. So it's just really, really nice feature. So if you did download this app, pharmacy is one of the best features for you to just really go take a look at. It's nice because it has a list of all the drugs you're taking, or that you've taken. So you can also say, these are my active drugs. I highly suggest you just go check it out. You're not going to break it. And it'll have your list there. Any questions?
And on here, you'd be able to find any test results. And I saw the bill situation, the claims. So you will be able to see what claims are pending, what claims have been paid. But like you said, I guess that's
Yes.
only relevant if you go out of network.
Nope.
Well, your regular claims will be there as well.
Okay.
It was only the submit a claim feature that you would need to use if you were out of network. That's the only one that that provider, because they're out of network, may not submit the claim on your behalf. In network, those doctors submit your claim, or under our contract, they're required to submit the claim on your behalf. Out of network is the only option, or only scenario where you would have to worry about submitting a claim for yourself.
Okay.
That
Now,
makes sense?
yeah, it answers my question. Now, where I see vision, is that to Blueview Vision? What's there at the
Yes.
Vision tab?
So this is basically a demo. So obviously dental is not applicable to this group, but your Blueview Vision will be in here, your pharmacy and your medical.
Yep. So you'll be able to see you go through and look at the vision benefits and all of those types of things through the vision tab or vision menu item, and be able to see what your benefits are and all of those types of things there too.
Yeah.
Okay. Does anyone else have a question?
Now, the blue vision, that's for your eyes, right?
Correct.
Okay, what I found from that sometime way back, they only deal with eyeglasses. When you have to go and have your eyes checked for your eyeglasses. But like with my doctor, eye doctor that I had to go to annually because of the cataracts, they didn't deal with the eyeglasses. They just dealt with the eye examination, and then I'd have to go to another place that was listed through the medical where I could go for the blue vision. You understand what I'm saying?
Right, because one is medical,
So
and then the other one is exams. Go ahead,
Your-
Tammy.
yeah, your standalone Blue View vision will be under this vision here that you see. That will be your Blue View vision. And then under the medical plan, if you were to go into your, let's say your eye doctor submitted a claim under your medical plan, your vision would be under the medical. So it's kind of, I know it's kind of confusing, but they coordinate. And the one thing I was going to tell you about the medical explanation of benefits, oftentimes I get somebody who says the doctor charged me $75 and I don't know why, or even $12 over. By viewing these explanation of benefits, you're going to see members' responsibility. And because your plan is actually a $0 plan, it should be zero regardless. But you'll be able to see that because some doctors, they don't understand the Medicare Advantage or think that they can balance bill, and that's not acceptable. So this is another reason why I highly suggest that you review your explanation of benefits. And I get emailed every time I get one. So it's nice because you're like, when did I go to the doctor? And it's like, oh, that was a prescription, and it's great because then you get pinged for that.
Right. Well, the reason I brought that up, Tammy, is because where my eye doctor is at, my primary doctor, that deals with the cataracts and all of that stuff, they had an eye place right in the building. But because of that blue vision, they couldn't service me. But now that Methodist has come into Fremont, Nebraska, now I can go right into that place right there. I don't know about the glasses, but when I have my eyes checked, they always have to look at my eyeglasses to say what they are and all of that stuff for me to take over to the doctor. So that's why I brought that up.
Okay, interesting. Okay.
Okay, Joyce, I see your hand.
Thank you.
Mhm.
Okay, based on what Ms. Moore was saying, so then it sounds like blue vision is you go for your eyeglasses and contacts, and if that's what you need, but if you have cataracts, you go through the medical arm of the plan.
You can. So the medical automatically covers cataracts, but in addition to that, so that's what's called Medicare covered vision, because it's to deal with cataracts. But in the same sense, through the medical, you have non-routine vision as well. And so that offers you a $0 copay for your vision with reflective exam. And then it gives you $100 towards your eyewear. Then you have the standalone Blue View vision. I believe that's a $20 copay. So they will cross-reference when you talk to your doctor and you give them both cards. They'll bill it under ours. You get the $100, and then they'll bill it under the other one because the copay is already paid. You don't have to worry about it, but you'll get another $150 towards your glasses or lenses.
Okay, but then, so then if I go in and because I am due to go in for my vision, for a vision check and maybe new glasses, if I have cataract, if I'm having a problem with cataracts, that is covered under the eye care?
Absolutely. Under your medical.
And then will the optometrist refer me to a doctor?
Most likely they will. They definitely will send you to an optometrist, ophthalmologist.
Ophthalmologist. Okay.
They could send you to one, but my sister went through the same thing. She went blind in one of her eyes, not knowing that she had a cataract. But when she went to get eyeglasses and whatever, They did not bring it to her attention whatsoever. So you always have to make sure you let them know, if you do have a cataract, that if you have a special doctor for that, to let them know, to notify them or notify your doctor yourself what they found. You know, some people don't always do what they're supposed to do, and sometimes we have to be there and make sure it's being done.
And that's what this, if you look and you see how he has it up right now, it says medical. Oh, sorry, that's the claim. There's the explanation of benefit, or there's your plan documents that tells you what your plan benefits are. I think it's either on the first page or up. Is it up top of that one?
Yeah, it's under your plans.
Yep, yeah. And so the nice thing about your plan is you can say, okay, what is my coverage? And even I've done this at the doctor's office, by the way.
Yeah.
I'm like, wait a second, I don't have, this, or this is what it covers. And so I've brought that up.
Yeah, so you can, in your plans, you can go into either the vision and see what your benefits are there, or the medical as well, to bring up the specific benefit information for each of those plans.
Okay, Tammy, in the chat, Shirley Tan wants to know how can she receive and how can she get a Fitbit?
So it's not a watch. Those are something different, but if you are enrolled in the Medicare Advantage plan, retired with Medicare and enrolled in the Medicare Advantage plan, then you can call the number on the back of your card and get set up with a Fitbit, and it's $0. And then they'll send it to you. And I actually did a class on that before. That one might not be up yet, but it'll be posted by next week. And it's the webinar that talks about the Fitbit, how to get it, how to use it, and what it includes. And so that's for Medicare Advantage plan members.
And I did find here a screen showing you the My Health records. So Joyce was asking about this before. This is what it's going to look like on the mobile. So you can go into any of your health conditions, your recent lab results, and all of those types of things. And again, it's going to pre-populate with all the information that we have from claims information, things like that. And then if you go down to the bottom, there's an option to import additional records. So that's where you would go through to link to get additional information from past providers or things like that you might want to all link up into this view.
Good questions, you guys.
There's a question in the chat from Robin. She said, can those not on Medicare receive a Fitbit?
Not at this time. That is part of the Advantage, the Medicare Advantage preferred PPO plan, and the benefits that offers. I know that plan offers a little bit more. So unfortunately, you have to wait till you're 65 or older, or that you're Medicare A and B eligible and enroll in that plan. So I apologize for that.
Thank you.
Are there any other questions? Over to you, Tammy.
Yeah, so I really appreciate once again your attendance on a Friday morning. We do have a few more coming up for this month. We actually have a Silver Sneakers webinar that is next Tuesday. And then we have an in-home. So if you're now Silver Sneakers is for everybody, the early retirees and the Medicare Advantage. So that one's going to be total. And then on August 23rd, we have a Medicare Advantage preferred PPO webinar that discusses your in-home care and those benefits and personal home helper. So those benefits that you can have somebody come over and either help you organize or help clean up a little bit and all those fun things. So I really look forward to seeing you guys next week if you're interested in the silver sneakers. And if there's no other questions, thank you so much, Jonathan. That was very informative and detailed. So appreciate
You're
it.
welcome.